We are CounterCOVID, formerly two teams that were asked to abandon our individual projects and join forces to create a product to assist with the new needs caused by the coronavirus pandemic. We asked ourselves, how can we make the greatest impact with limited resources in a short time frame? And developed a product to serve King County residents, particularly at-risk communities, by providing an accessible and personalized COVID-19 risk assessment with next steps. We developed solution goals to remain local to the Washington-King County area and serve at-risk and vulnerable communities, which we identified as low income, low education, immunocompromised, and English as second language speakers. We developed 3 key features, the first being a detailed risk assessment tool, where a user can fill out a symptom and health assessment for themselves or a loved one, an up-to-date list of best practices, where a user will receive personalized and up-to-date steps to take, and they can later save the results as a PNG to share. And lastly, we included 10 languages that can be translated in the most commonly spoken languages in King County. This helps the ESL communities to now access the information they need regarding the coronavirus. CounterCOVID helps residents in the King County area to have a reliable and centralized tool that reduces misinformation, eases crisis fear, helps to treat, and helps to prevent the spread of the coronavirus. Our next steps include handing off the project to our sponsor, Last Mile Ventures, and updating the quiz questions and results to reflect the emerging information about the pandemic. And now for our product demo.
Where we have users answer several questions, receive a COVID-19 risk level, and receive possible next steps specific for people in King County. Before we get started, I want to quickly go and view the terms of service. Don't worry, we're not going to read the whole thing. That would take way too long. I just want to point out this section here that talks about how we worked with researchers and professors at Johns Hopkins University to get the algorithm for this quiz because we realized we are not medical professionals and wanted this data to be as accurate as possible. With that being said, let's go home and walk through the application. So you can either choose to take it for yourself or for someone else. For this example, we're going to take it for ourselves. Then loads in the data, and the first question that you're asked is if you're experiencing any of these severe symptoms for COVID-19. If you answer yes, it will tell you to stop taking the quiz and contact medical professionals immediately and call 911 because these symptoms are shown to be extreme. If you did not mean to click this, you can go back and it will not retain any of your data. That's one big thing we wanted here with this quiz, is not to actually collect and keep any user data. The next question asks if they are 60 years old or above. The next one asks if they're experiencing any of the following symptoms related to COVID-19 with small icons on the side to help describe the symptoms. And the final question asks if they have any of the following chronic diseases related to COVID-19. After this, it will calculate your results and come up with a risk level and recommended next steps. The risk level is highlighted in bold at the top and has a quick summary of what that risk level means. As you can see, this person here is at high risk. The recommended next steps are broken up into small subsets with easy to follow steps and the potential to offboard users through different links to get more information if they would like more information than we provide. If the user is at a risk level where they need to contact medical professionals and they do not know how to do so, they can use their insurance plan using a lot of the local Pacific Northwest insurance providers, find a doctor tools, and these links will take them directly there. And if users do not have an insurance plan, they can use these tools such as finding a community health center to go to an already pre-searched and pre-defined Seattle area, and they can either modify the results to fit their area better or export these results as a PDF. Speaking of exporting results, users can go ahead and download our results here by clicking this button and download the results as a PNG, which we chose to do because this will easily allow users to download the results on mobile because PNGs are a lot easier to work with. In addition to that, if you do get low risk as your risk level, we have ways that users can consider safely helping their community by doing things like donating to Seattle Children's Hospital or working with Bloodworks Northwest. Final feature I'd like to go over was one that was very important to us. That was translating it into additional languages to help ESL communities. We translated it into the 10 most commonly used languages in King County. So you can click on it and we'll completely translate the quiz. Users can go through the quiz in their native language. And after they do this, it will go ahead and give them results that they can also download in their native language. This is the presentation for CounterCOVID. Thanks for listening. If you have any questions, we'd be happy to answer them now.